Since October 7th, Israeli soldiers have been coming home with all kinds of injuries, from shrapnel wounds to burns to vision loss. Eye injuries in particular have actually surged, leaving hospitals struggling to meet the demand for specialized care. Well, now there's a major step forward. Barzilai Medical Center has just opened state-of-the-art eye surgery suites, thanks in part to Dr. Stephanie Becker, a U.S. ophthalmologist who jumped in to help from day one. And she's joining us now to share why she got involved and what more needs to be done on this end. So you have worked with eye trauma patients for years now. What made the injuries that you saw after October 7th stand out, and why did you feel compelled to help build these new surgical suites at Barzilai?
Well, I have to say that I was involved with Barzilai before October 7th, basically because it's such an amazing group. Their administration, their doctors, the whole staff, they're just amazing, amazing people. And then after the massacre on October 7th, what do we always do? We jump in and see what we can do to help. So I went to visit my friends who were there right after this tragedy. And as we were sitting in the eye clinic, in one of the offices, obviously with snacks because it's Israel, there was a siren. So we had to go into the protected space. And as we came back from the protected space, we passed where there was a direct missile hit. And I said, how can they treat our soldiers like this? How can we do this? Then as we're walking down the hall, I see these gorgeous young men who had been injured and had eye patches on both of their eyes. And I thought, wow, these young men are our children. They have to be treated with the utmost respect and care that is out there and is possible. So my first reaction as a physician is, how do we prevent an injury? And statistically, there is a known rate of ocular injuries in warfare. It's higher in this kind of guerrilla warfare and urban warfare. So the first arm of the interventions that I wanted to put into play was protection and prevention. So we tried to start a campaign to educate the soldiers to wear their protective eyewear, but to also make sure that they all had what they needed in terms of the eyewear that would protect them best. On the flip side of that, if there is an injury, you need to give them the absolute best, most high-tech, most cutting-edge treatment that's available. The surgeons at Barzilai are amazing. I said, do you want me to come and operate with you? I have two hands. I'll be happy to be there with you. And they said, no, to be honest with you, our team is amazing and they are prepared. We just need X, Y, and Z, operating microscopes, these pieces of technology, like that. So that's what we made happen. And so my goal was to make sure that every mother knew that their children were being taken care of in the absolute best possible way. So important for our community and our nation to understand that we all care so much about our soldiers, and nothing would stand in the way of any kind of treatment that they would need. Not money, not staff, not motivation, that we are all in this together. And so what do? We leap into action. We raise money. We make sure that everybody can get what they need. Not always so easy in the beginning of a conflict when there's no commercial flights or no, cargo flights, but you make happen what you need to make happen.
Well, I have to say, obviously following October 7th, there was, so much focus on the mess, the military, what the military needed, not so much on the medical facilities almost initially. And I think that was what was so concerning to the health professionals within the state of Israel, who all of a sudden saw this surge of patients and didn't really feel like they had the resources and ability to address the ongoing needs of these soldiers. Obviously, when we think of eye trauma, that's only one type of injury out of many, many different cases that we've been seeing since October 7th. How have these suites been able to help the soldiers so far?
So one of the most important things that I thought we needed to do, and obviously this was in conjunction with the chairman of the department, was to make sure that they had the best surgical equipment in the operating rooms that were in the protected space, so that they could work on trauma patients no matter what was going on around them. And that was crucial, because being so closely located near Gaza, that's one of the first places they bring the soldiers with a
Right.
critical injury.
Well, I'd like to thank you so much for joining us. It's really, really interesting to hear, about the work that you guys have been doing. Obviously, no small feat to make sure that, the resources are there for these medical professionals, especially in Barzilai, which you mentioned was hit very early on in the war with a missile. Luckily, there haven't been as many direct hits to Israeli hospitals. We did see Soroka in the latest war with Iran. But it's just so essential to hear about the work that's being done by people just like yourself to make a change here. Thank you so much for joining us, Dr. Stephanie Becker.
Thank you so much.